Wow, this video is actually going to put me in trouble with you, my viewers. This woman is pregnant. Why? She missed her periods. She did a urine pregnancy test and it turned out to be positive. She went to the hospital. They did a urine and a blood pregnancy test. They all turned out to be positive. However, she does not have the baby in the uterus. There is no fetus in the womb. What is happening here? And how do you use Adapalen to treat pimples? All that in this very particular video of Ask Dr. Uthman. Don't go away.
Ask Dr. Uthman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Uthman YouTube channel, a channel where you learn medicine at the comfort of your living room. I told you if you'd like to get in touch with me to have a private chat, go to my website www.druthman.com and book an appointment. And I assure you, with that appointment, with that consultation, you will have a high level of confidentiality and privacy. So let's now dig into the question of the day. But before that, if it's your very first time to watch this channel, please don't forget to subscribe and also press the notification bell in order to be notified of any important upload we make. Let's see this question from the lady Tina.
Hello doctor, good afternoon. My name is Tina. So last year I got pregnant and it was about 4 months and I got some complications. Ne doctor nangamba nti omwana taliimu, omwana teyatonda, so ne balina okunongosa and kati mbadde mbuuza, what can I do, what can I use so that I don't get the same complications?
Now what she is talking about is called a blighted ovum. A blighted ovum. What is this animal called a blighted ovum? Now, with this condition, there happens fertilization. What I mean is this. With this condition, fertilization will occur. How will it occur? We shall have movement of our sperms. Sperms will move and meet an egg which is here, that has also moved from here, and then fertilization will occur. Fertilization will occur normally, the normal ways of fertilization. A sperm will meet an egg and fertilization occurs. Now, after fertilization, what will happen is that this fertilized egg, or what we shall call a zygote, will move, will be transferred back into the uterus, and therefore when it reaches the uterus, it will implant itself here, or it will attach itself here. Now what will happen is that there will not be development of the embryo. There will not be development of the embryo. Fertilization has occurred, implantation has occurred, but the embryo will not develop. Or the embryo will develop for a very short time, and therefore it stops growth. Therefore, what is going to happen is that this woman is going to get signs and symptoms of pregnancy. Number one, this woman will miss periods. Number two, this woman will have nausea and vomiting, all those signs of pregnancy. But because the embryo has not developed, this will not be a real baby. It will just be having a gestational sac. What we call a gestational sac is like it will be the product of this mix of the union between the egg and the sperm, and it will just form something, some body there, without the gist, without the seed, without the fetus. And therefore, this is what we call a blighted ovum. It is so unfortunate that when you have a blighted ovum, after those signs and symptoms of pregnancy will come, and you run a urine pregnancy test, it will show you that you are pregnant. It will be positive. Even when you run it with an expert in the laboratory, in any laboratory in the hospital, it will show you that you are pregnant. Madam, prepare for childbirth. But who told you? the baby is not live. It is just a gestational sac. And this is what is so devastating, that a woman is being told that you are pregnant, but there is no baby. There is no baby at all. Signs and symptoms are occurring. Someone is happy that they are going to have a baby, but there is no baby. It is just the gestational sac. Now, what is causing this issue? What is causing this issue? And by the way, with this, even a blood test, a blood pregnancy test will show you that you are pregnant. Now, let's dig into what causes it. The main cause, or what most people think, what most scientists think, is that chromosomal abnormalities is linked with blighted ovum. What are these chromosomal abnormalities? Especially chromosomal abnormalities at chromosome 9. What is happening is that either the sperm has an abnormality or the egg has an abnormality. It is of a poor quality. If the egg is of a poor quality and all the sperm is of a poor quality, they will, of course, meet, fertilize, implant, but the embryo will not develop. Number 2 is ancestry. What is ancestry? I think everyone knows marrying your close relative. People who are closely related, especially the first degree relatives, they are prone, if they get married, they are prone to having a blighted ovum. And also, from statistics, it shows that if you've ever had a blighted ovum, there are very high chances, or you are at a great risk of having another blighted ovum. The signs and symptoms will, of course, be the same like any other pregnancy. You will miss periods. You will have nausea and vomiting. But as probably the pregnancy progresses, you now develop abdominal pain and some spotting. So what happens to this blighted ovum? Definitely it has to be removed. And how will you know, how will you confirm that you have it? You are going to do an ultrasound scan. An ultrasound scan will be done. That is why I encourage women to always do early neonatal scans. Do early neonatal scans. When you go and do a pregnancy test, they confirm that you are pregnant. They confirm that you are pregnant. Try and do a scan to rule out any abnormalities. But women fear that scans have side effects. I've always told some women to do a scan. And, doctor, you know, scan, it can even kill my hormones. They fear scans. But a scan is very important, especially that early neonatal scan, because it will show you that you do not have a baby inside. It is just a gestational sac, and you'll plan on what to do. Most of them get out on their own. They get aborted on their own. They are miscarried. However, some of them fail to be miscarried. They remain there, and it must be an intervention by a doctor for it to get out. How? You will take medicines like misoprostol, and then when you take those medicines, they will clear it out. And all some others, you may need to do a dilatation and curettage or a manual vacuum extraction, and you remove this thing, because even if it spends years there, it will never develop into a baby. You've heard of stories in villages there where women are saying, I got pregnant and my co-wife, I hear tied that pregnancy onto me. I hear they did some witchcraft and I have passed a year, I'm not able to give birth. That is not witchcraft. It is real medicine that you have a blighted ovum and therefore it cannot grow into a baby. You have to remove it. You have to remove it. So the treatment for blighted ovum is to remove it. You cannot bring it back to life. There is already an abnormality. You must remove it. So how does someone prevent? How do you prevent yourself from getting a blighted ovum? I may say that the preventive mechanisms are not really clear. There is no straightforward answer that you can do this to avoid. But you can go scientific by doing what we call pre-implantation genetic screening. Pre-implantational genetic screening. What does this mean? When fertilization occurs, we can do that test. We screen and find out whether there is an embryo in the fertilized solution, in the product of fertilization. Is there an embryo? You can do a pre-implantation genetic screening. Then also, because we've said that it is usually an abnormality with a sperm or an abnormality with an egg, you can do semen or what we call sperm analysis. If you have your partner, before you even think about conceiving, your partner, your male partner, can do a sperm analysis to look at the quality of his sperms. Do they have any abnormality? If they are okay, the quality is good, then you can go on. Even a lady, you can do hormonal tests like follicle-stimulating hormone and anti-mullerian hormone, what we call AMH. These two tests will tell you or will be able to show us the quality of your eggs. And therefore, if we identify or if we find out that the quality of your eggs is low, then we can try and give you some medicines in order to bring it to a very good normal so that you can have a good pregnancy with an embryo. Now, how many question is, what should I do? What should I do in order to have a good baby after that? Now, what you are going to do is, what? Pre-implantation genetic screening. 2, do semen analysis on your man, on your spouse, and also do a follicle-stimulating hormone and anti-mullerian hormone, or AMH, to identify or to ascertain the quality of your eggs. However, let me tell you, many women will still get another pregnant, will conceive again, and give birth to very live babies. Let's have another question.
Good day, Dr. Osman. My name is Noella from Italy. I don't really know. I want to ask. As you can see, this is my face, and it's very rough because of the pimple and everything. And you asked me to buy Adapalen. So I don't really know how to use it, if it will work for me, because this is my skin and my face. I'm really tired of going out like this. It's so disgusting. So please, I need your help. What should I use? If it's the Adapalen, then how many times a day should I take it? Please.
Now, my work is very simple in this question. How do we use Adapalen? By the way, I discussed about pimples in one of my videos. Please, I encourage you to check for my video which is talking about how you can treat pimples. But for the interest of her question, she's asking how she can use Adapalen. First of all, Adapalen is a retinoid. It's a retinoid, and therefore it contains 0.3%. So you can go and buy this cream called Adapalen, 0.3%. When you get your cream, apply it on the pimples directly. Just bathe, shower. After bathing yourself, of course, try to dry. After drying, now apply the cream directly onto the pimples. Now, what you're going to do is that you'll be applying it at least 3 times in a week. It means you have to skip a day. When you apply it today, don't apply it the following day. Then apply it the other day. So you alternate the application. Now, after doing it for 1 week, it means your skin, your body will be acclimatized, will be used to this cream. And therefore, what you can do is to apply it daily until the pimples have disappeared. And I told you that you may not use only Adapalen. Don't use Adapalen alone. Apply it with some other medicines. Use doxycycline. We talked about either using doxycycline or clindamycin. These tablets or capsules, you swallow them. So I told you it must be in a combination. If it's Adapalen, let it be Adapalen with doxycycline. But you also remember I talked about some other drugs like Dapsone. I talked about Dapsone. I talked about azelaic acid. All those are creams. When you find them in the pharmacy, buy them and apply them onto your body, plus all with doxycycline, all clindamycin. Then, my friend, you'll get rid of those pimples. And lastly, I also said that for those of you who do not want to give birth, still you can use oral contraceptive pills to get rid of pimples. If it's your very first time to watch this channel, please don't forget to subscribe and also press the notification bell in order to be notified of any important uploads we do. And if you'd like to get in touch with me to have a private chat, I told you that go to my website www.drothman.com and book an appointment. And lastly, you can chat with us on all our social media platforms, and the name is Ask Dr. Othman. I sign out.
Ask Dr. Othman on Sawa Wall.